Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources. Welcome to today's edition of Helping Seniors Television from the Helping Seniors Network. Whether you are caring for a senior, are a senior, or just plan to be one, we hope you'll enjoy today's program. You may have seen a sign or billboard about Vitas Healthcare. On this edition of Helping Seniors TV, let's get an introduction to Vitas. Pamela Struzinski, Education Coordinator and Registered Nurse, talks with Helping Seniors TV host Kerry Fink about how they bring comfort and peace in the middle of difficult situations. I'm Kerry Fink with Helping Seniors Television. It's a pleasure to see you, and it's a pleasure to be here today sitting in for Joe Steckler, our founder and president on Helping Seniors TV. And thanks for joining us today. I think you're going to find the show very informative. It's the introduction to Vitas Healthcare. Now, one of the things that I'm sure you have seen a sign or maybe you've read one of Pamela Struzinski's articles in the Helping Seniors newsletter that comes out each month in Senior Scene magazine. But we're delighted to have Pamela here with us today, and thank you for joining us on the show.
Thank you for inviting me.
So Pamela is a registered nurse, has a long career with Vitas, 13 years, you said.
Starting this summer.
Yeah, and it's just going to be a great show to get some information. You may have seen, like I said, you may have seen a billboard. You may have run across one of the articles. You may have spotted some of the folks from Vitas at a senior expo or a health fair someplace, and just always been curious, what is Vitas Healthcare? And that's what we're going to talk about today. So, in fact, you work for Vitas, but let's just start with that. Mm-hmm. Tell me a little bit about Vitas.
Vitas Healthcare has been around for over 40 years, established back in 1978. We just had our 40th year anniversary.
Wow.
It was started by a registered nurse and a minister down in the South Florida area. They had a friend who was presented with a terminal diagnosis, and that friend asked them to help take care of them. And after that experience, they saw where the needs were in the community, in the country, and they started work, and here's Vitas 40 years later.
I think you were sharing a statistic about how many different states the organization is in.
Right. Right now, Vitas is represented in 14 states plus Washington, D.C.
And the number of patients, I think, that you mentioned that that you take care of every single day is in the, what did you say?
18,000, represented by over 12,000 employees.
Wow. Now, I know we had talked before that you mentioned, because of your long tenure with Vitas, which to me actually speaks volumes about the quality of healthcare, when you know somebody has joined an organization and stays with it, that seems to give a lot of integrity to everything that you guys are doing. But having been with that organization, you mentioned that at one time it was called Vitas Innovative Hospice, and that you explained that very proudly to say, this is why we are who we are, because we really try to be there. Could you explain a little bit behind that?
Right. Yes, we were Vitas Innovative Hospice for quite a while, and we were proud of that name because we felt like we were innovators in the hospice community. We were taking on those very difficult, high acuity patients that, for whatever reason, other hospices would not or could not. So we were proud to be called that.
And I would imagine, we talked about this before, that one of the terms hospice is to people that have not necessarily been familiar with the process, it's sort of a scary sounding word or an ominous sounding word. But we've talked about it a little bit, but tell me what hospice actually is so we can get misperceptions out of the way.
Right. For a long time, I think many people think hospice is a place that you go to. And in its early beginnings in Europe, it was a place. But hospice is a rendering of services that we come to you in your home, where that home may be a private residence, a nursing home, an assisted living facility. It's wherever you are, we come to you and we bring our team to take care of you there.
And you said for hospice to come into play, there's a certain medical diagnosis that is in place, and that is tell us about how that part.
For a patient to be eligible for hospice care, they are referred by a physician, and a physician has to certify that their diagnosis is a terminal diagnosis that will give them a prognosis of 6 months or less.
And when that happens, that has to be, we talked about it before, but that has to be a frightening time for everybody who's involved. They're now coming face to face with a big transition and trying to think through everything that means on so many levels. But you actually take a care team approach to the whole process. Tell us a little bit about a Vitas hospice care team. Who's on that team, and how does it work in favor of the family and in particular the patient?
Okay. We start, our first team that encounters a patient is our admissions team. And they're a group of registered nurses who either come to the bedside in a private home, they will go to visit a patient in the hospital, wherever the patient is, and they will evaluate the patient to see if they are appropriate for or eligible for hospice care. Let's say a patient has been admitted. Now that team comes in. That team consists of a team physician, a registered nurse case manager, a certified nursing assistant if the patient needs it, a licensed social worker, a chaplain, volunteers if need be for certain things for the patient and family. It's the team approach, and that whole team is managed by a team manager.
So you are not in this at all by yourself when it comes to
Absolutely
calling
not.
in hospice.
Right.
That must be a comforting factor for people when they're facing that kind of a diagnosis.
Correct. A lot of things can come up at the beginning. Lots of questions. We have that psychosocial team that can come in and help with those financial questions, those spiritual issues that may come up. We have a big veteran community here in Brevard County, and when those veterans are faced with that life-limiting diagnosis, a lot of emotions present themselves, and we have some veteran liaisons and bereavement services that can come in, and chaplain services that can come in and help them with those life reviews and help them work through that.
It's funny, when Joe Steckler founded this organization, the Helping Seniors organization, he founded it in 2011 after he had successfully founded the Brevard Alzheimer's Foundation and got all that rolling. They named Joe's Clubs daycare centers for him here in this community. And I remember when I first met Joe, and he said, Kerry, he said the work of the Alzheimer's is important, but he said what I'm finding is seniors have many issues that go beyond simply just memory care. They're having trouble with issues of life, just transportation, housing, medical questions, financial questions, legal questions, all these different kind of things. And one of the things that Joe said about when he created Helping Seniors of Brevard, he said, I want to make a 501c3 charity nonprofit that our goal is to help as many seniors as we possibly can. So one of the things we do as an organization, as you know, is we have the Senior Information Helpline here in Brevard. It's a free call throughout Brevard County to 321-473-7770. 321-473-7770. And since this organization was founded back in 2011, we've helped over 2,400 families free of charge in this area. And interestingly enough, we get calls literally from all over the country. Oftentimes it starts with maybe an adult child of a senior who lives in Brevard County said, listen, I was just down from Chicago to visit mom over the Thanksgiving holiday, and was really kind of concerned about where she's at and what's going on. And I don't know anybody down there, so I don't know where to begin on this process. And so one of the things that has been important with helping seniors is not only that inbound where we try to help somebody, but Joe has always been strong about getting outbound information. So people could pick up that Senior Scene magazine in the waiting room at a doctor's office or at the library or wherever they run across it, and they can get access to that Helping Seniors newsletter that's published every month in the center of it, or they can see one of these TV shows. And the whole idea is to get you expert help so that when you're facing something, you know what to do. So the very fact, for example, we have a board certified elder attorney who's been connected with this organization for many, many years. And so when you're dealing with legal questions, you're going to call somebody who has been through this road many times because they're going to be a great source of comfort and knowledge when you're trying to figure out those kind of questions. The same is true if we talk about things like we have, for example, the Eye Institute has been partnered with Helping Seniors for many, many years. And so a lot of times as we age, we have issues about eyesight. And it's the same thing. You want to go to somebody who knows that territory. And boy, when it comes to these kind of things where you're talking about a terminal diagnosis and a certain amount of finite amount of time, you really want to go to an expert, don't you? And that's what Vitas is all about. I want you to expand a little bit because you must be a wave of relief to a family as you step in.
I agree. Like you said, so many things pop up, present themselves, financial issues present themselves, emotional issues, spiritual issues, not to negate the physical issues that may be happening with the patient. The nurse is there to handle those and to take care of those. But it's not just physical pain that we talk about. We have spiritual pain, emotional pain that can be presenting itself with a patient. And that's what that team approach is all about, that interdisciplinary team where they can all come in and help the patient.
So we wrote down this question here. What are some of the specialty services? And I think you're touching on them. What are some of the specialty services that Vitas provides to its patients?
Well, we have some great specialty services. We have veteran liaisons who work with our booming veteran group here in Brevard County, a huge population. We have a music therapist, soon to be 2 music therapists that work out there with our patients and families. They music can calm.
I was going to ask, tell me about.
Right.
I have an idea of a music therapist, but I'm not sure
Right.
I have it all together. What?
Our music therapists, before they go out and visit a patient, they do a little research and they find out the demographics of the patient, the age of the patient. They might talk to the family and say, what was their favorite music?
Okay.
So when they come into the home, they may help them write a song for their family to leave behind. They may play music that is familiar to them, and it can help with comfort.
There's no question. So this goes well beyond just trying to keep a patient feeling as well as they can. There's so many more dynamics to what Vitas Healthcare can do. So when does this process come into play? How does the ball get rolling? And I guess a question that I wanted to ask you is, I think we talked about that in many locations, and certainly in our location, people do have a choice of who to call in terms of a hospice care. How does someone choose which hospice to turn to?
They can research. If you're faced with a terminal diagnosis and your physician has referred you to hospice, you have a right to say, I would like Vitas or I would like one of the other hospices, because there are multiple hospices in Brevard County. But a family and a patient needs to know that they do have a choice.
So I'm just making this up, but say you were you're sitting in a hospital bed, and now you've just been faced with this with this new decision that you're going to make. And there might be well, I don't know who to call. It would be important that they know to call Vitas and have that in their thinking. Like, I should get some information from them, because you can always make the decision, but it's best to make the decision with all
An
your
informed decision.
yeah, with all your possible options on the table, right?
Right, absolutely, absolutely. And it's so imperative that our patients and families know that they do have a choice. They do have a choice to make a choice.
Well, and that was one of the things we've talked about this, but I think one of the factors that people may not be aware of is that typically the cost of hospice is not necessarily something that the family is going to bear directly, right?
Correct. 90% of the cost of hospice is covered by the Medicare/Medicaid benefit. If you've paid into the Medicare system your entire life, when you're presented with a hospice option, 100% of the costs related to your terminal diagnosis is covered by your hospice benefit.
And I think you mentioned even in those odd cases where maybe somebody isn't in that system, but even because you are an organization that does care, you actually step in and on a charitable basis.
Yes, we do. Not everyone has a payer source, Medicare, Medicaid, or private insurance, and we will not turn away a patient due to their inability to pay.
So it's really important, viewer, that you understand that hospice is available at that time, and that you need to know how to get in contact with Vitas Healthcare so that you can get good information. How does Vitas cater to patients who have all kinds of, we come from all walks of life. We have all different ideas and all different ways of doing things. How do you work with, and especially here in Florida, whereas many people move to Florida later in life and come from this state or that state, or this was our lifestyle here, this is our lifestyle there. How do you work with all those diverse populations?
I think something that Vitas has done for the years that I've been with them is they have those diverse employees also, so they can relate to those diverse communities. We have a diverse amount of employees that are, we have Haitians and Jamaicans, and lots of our employees that speak different languages.
I was going to ask, so what if English is not your first language? You're still able to find some help.
Correct. And if we don't have an employee that can speak that language, at the bedside on our mobile device, our nurses can access an interpreter.
Wow.
For any language.
So you're really able to work with people on so many different levels. But no matter how we want to talk about it, death isn't easy to discuss. And so if someone who may be watching today is facing a potentially terminal illness, maybe themselves, maybe it's a family member or a situation very close to them, what advice do you give them? What do you ask them to do? Here's the step you might consider taking.
Do some research. You can go onto your internet. You can call. You can go to vitas.com to find out all things about Vitas. We have a 1-800 number that's available 24/7, 365. 1-800-93-VITAS. Do your research. Know that we have, we're Medicare, Medicaid certified. We're licensed by the VA, the Veterans Administration. We take care of many, many veterans.
Well, another thing I was going to say is you're also able to meet people on various different levels, because I think those of us who are not as familiar with hospice, like you said at the start of the show, we're thinking it's a building. And in the case of Vitas, it is a building, or it could be a building, but it could also be in the home and all this. I want you to talk just for a minute about the different venues that Vitas is able to provide support for.
We have what's called levels of care. We have routine home care, which is a patient who's seen routinely. They might be typically early in their diagnosis, but they're still appropriate to be on hospice. We have a higher level of care called shifts of care, where if a patient is experiencing a symptom that requires a skilled employee to be at their bedside, we can do shifts of care up to 24 hours a day to take care of those symptoms, an LPN, RN, or CNA during the day. We also have what's called respite care. which respite is for the family. Let's say caregiving is one of the hardest jobs out there. It's a very difficult job, and it can be very trying and very emotional. And we offer our families respite care. That is 5 days that is paid for by Vitas. We will move their loved one to a nursing facility in Brevard County of their choice. They choose the facility, and we will transport them there. We will visit them there just like normal if they were at home. And the family has 5 days of respite where they can do what they need to do if they just need to recharge themselves, or if they needed to go for a short trip away from home. And then we transport the patient back home. And then we have our inpatient unit level of care, which we call general inpatient, and that's where our new inpatient unit comes into play. It's the second unit of its kind built by Vitas. We typically have not in the past had freestanding hospices, inpatient units, and we've built a 14-bed, all-private room facility on US 1 before you enter Rockledge, and it is for those patients who, for whatever reason, we can't handle those symptoms at home. Okay, it's an option for them to go there. It has a beautiful family room for the family if they need to step away from the patient. It has private bathroom where they can shower if they need to, a family kitchen if they want to fix a meal. And it's a wonderful facility, and we're very proud to have it here in Brevard County.
You know, one of the things as you were going through those different ways of serving a family, I got to thinking, this isn't just about the patient, but it is really about the family, because especially when you hit on the caregiver issue, we talk about this a lot at Helping Seniors, that oftentimes, especially if it's a long-term situation, being a caregiver, the caregiver the person being cared for can sometimes outlast the caregiver because there's just so much stress. And that respite, that ability to get a break is so important. And whether that come in the form of just having backup for everything you're doing, whether it's in your own home, whether it's taking advantage of a respite care break, or perhaps the comfort and safety of knowing about an option like the inpatient way of doing things. All those seem to match, and that's really part of what you guys do as Vitas, is sit down with a family and try to chart the best course given all the points of a situation, right?
Correct. It is their path, and we're just there to help guide them along the way. They ask the questions, we offer advice, or we help lead them in certain directions.
So I wanted to ask you, because you have you were explaining that your own history is fascinating. You said you came up as you began your work as your registered nurse, but you found yourself working in hospice care and literally on the patient level. And then talk a little bit about just your journey of how you've grown through the Vitas organization over the years.
I first came to Vitas as a registered nurse case manager. I worked on one of the teams right around the Melbourne office vicinity. I was a case manager for 3 years in the field, taking care of patients and families. Then I moved into a management position that managed the continuous care department, which is that level of care that is managing that symptom that requires someone to be at the bedside 24 hours a day, up to 24 hours a day. And then I moved from that position, was there for 5 years, moved into a team management position where I managed a team that encompassed Cape Canaveral all the way down to Melbourne Beach, and took care of that community for 3 years, and then moved into a patient care administrator position for a couple of years, and now I'm moved into the clinical educator position.
Which is no small position, let me explain, because what it sounds like is you started at a very, very much hands-on level, and with your experience now, you actually set the training as people are joining the organization, so they can provide that excellence in care, I would assume. And I wanted to ask you to just share, you said it for you, I said, why would a registered nurse or a person say, this is what I need to do? And you explained it's actually, you feel like it's a calling. And I wanted to get you just to explain you said something really profound before the camera was rolling about people come into the world and people come out of the world, and it's a special time to be there at either side.
It is. My father was on hospice for a very minimum amount of time, just 6 weeks, and I knew that would be my calling, that I wanted to do what I saw take place with him, and I do believe it is a calling. We were speaking earlier, there's those nurses who bring those beautiful babies into the world, and then there's those nurses and employees that are holding the hand of a person when they leave the world, and it's very profound and it's very special.
And it's such an important time to not be alone, isn't
Correct,
it? When you think,
correct.
and that's not only for the patient, but it's for the family and for everybody connected. And that's why the work of Vitas Healthcare is so important. Now, if somebody is, maybe they're not running up onto anything right at this minute, but something that you've said in this show has maybe said, you know what? I need to get a little bit ahead on this. I need to understand this better. Where would you send them? What would you tell them that they might do for the next step?
Okay. We have two different options. They can go to vitas.com and get a multitude of information from that website, or we have a 1-800-93-VITAS phone number that is open 24 hours a day, 7 days a week, 365 days a year, which is what Vitas is. We're 24/7, 365.
That's so comforting to know. And I was going to say, viewer, if you visit helpingseniors.brevard.org, helpingseniors.brevard.org, you'll find a great deal of resources. We've done a number of TV shows with Vitas. You'll also find every article that Pamela has written, because all the Helping Senior newsletters are also archived on that site. And you've covered you've talked everything, if I remember, from the music therapy to pets and all kinds of different veterans and all kinds of things like that. So there's really a lot of resources too on the Helping Seniors of Brevard website at helpingseniors.brevard.org. We have probably like 30 seconds left, but I wanted to just ask if you had a closing thought, but also to thank you for being on the show with us today.
Thank you for the invite, and it's just important that we help people to make informed decisions, about what they may be facing.
That's right. Thank you again, viewer, for joining us today. And thank you, Pamela, for being on the show with us today. And on behalf of Joe Steckler, our president and founder for Helping Seniors of Brevard, thanks for viewing with us today. I'm Kerry Fink. Hope you have a wonderful day.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniors.brevard.org. Thanks so much for your help. It does make a difference.